As COVID numbers continue to surge and more schools are going virtual, the push is on to get more children vaccinated, especially among communities of color. I mean, take a look at the numbers. According to the Philadelphia Department of Health, only 8% of African American children ages 5 to 11 are vaccinated, and 12% of Hispanic children have received at least one dose of the vaccine. And compare that to 24% of white children and 31% of Asian children. So what is the reason, and what do we need to do to change that? I want to bring in Dr. Ayla Stanford, founder of the Black Doctors COVID-19 Consortium, joining me now. Good morning to you.
Good morning, Alex.
Well, first, let's start off with why. Why are we having these disparities between children?
So I think we did a huge disservice by presuming that because we got the rates up in adults, that would transfer over to children. Just as we have shown how important trust is, how important convenience, opportunity, the messenger providing the vaccine is in adults, that same thing is needed for our children. So for kids, you got to go where the kids are. That's in school. That's in their after school activities. That's with sports. And more emphasis, not when we were in the middle of seeing that the rates are low, but prior to us even knowing the vaccine was going to be approved in our children, that's when the planning really needed to be started and prepared to be implemented.
It's interesting that you mentioned the adult vaccination stats. Let's put those up on the screen because it's quite a difference when it comes to the number of adults who are vaccinated compared to children. I mean, 69% of Hispanic Philadelphians have been vaccinated, 61% of Black Philadelphians vaccinated. So do you think, you know, when you said we focus on the adults, do you think they think, hey, I'm a different story. If it's my child, this is a different situation?
Alex, you hit the nail on the head. Remember back January 2021, those first stats came out. African Americans were less than 10%. It was actually 8% of African American adults were getting vaccinated. That took time for Philadelphia to be the highest percentage of African Americans vaccinated across the nation. It wasn't a switch that was flipped overnight. It took investment and trust and time and being present, consistently present. You know, right now for our children, we have vaccination locations, but there's one at the zoo. There's one at the link. There's some in the schools, but there's not one place where parents can go and know that this is where I can get my child vaccinated when I get off work, during the school day, in my neighborhood. There's no portal where everyone is being disseminated the information so they have the opportunity to take care of their child.
Okay, so you're saying it needs to be, I mean, people have jobs, they have other things to juggle, it might need to be more convenient. I mean, we know the school district of Philadelphia, the next one that they have, I believe, is January 5th at Edward Gideon Elementary School. But are you saying it needs to be more widespread? You need to have it at different school locations?
I think we learn from what we previously know. We know where the vaccination rates are lowest. Those zip codes need to be targeted. I personally think that, yes, if we all pooled our resources, meaning the consortium and UNIDOS and CHOP and St. Chris and the health department and Temple and Einstein, and we all decided that one day we were going to be open for 6 to 8 hours and provide that service so that folks knew that they could come to us after work and on weekends, it would matter. You know, some folks get a link from a hospital to say this event is happening on this day. But if your child is not part of that healthcare system, you're not going to get that link. Some people showed up to the zoo the following day and there was no event, because they presumed it would be there for consecutive days. So it's got to be a clear message. It's got to be consistent. It has to be disseminated widely to all the places. And we've got to advocate for our children. And I apologize for the long-winded. Athletic directors have reached out to me because it's mandated that student athletes be vaccinated. They are bringing children to us to say, can you vaccinate our wrestlers? Can you vaccinate our basketball players? These are scholar athletes that have an opportunity to go to college because of their skills and their knowledge, and they can't. And the kids, I say, why'd you wait so long? And they say, well, my coach brought me. This was a place I knew I could come. And that's it. There's no long reason why. It's just opportunity and convenience. And that's how we get our kids taken care of.
So what do you say to someone who'd say, well, they could always go to CVS or some of the other ways to get it
Right.
and make a
Right.
reservation?
You are, again, if you're not in the CVS system, if you don't come with an insurance card, you're not going to be the one that's cared for first. Hands down. I've heard people tell me that over and over again. And so we are open. You know, you said there's a school district clinic on January 5th. Well, what happens from, you know, December 22nd, 23rd? We know the cases are going up. Everybody's about to congregate. What happens? You know, Omicron isn't taking a break because it's Christmas and New Year's, right? Something still needs to be available for those families. This is a prime time to get them vaccinated, and folks are going on vacation. And so we need to learn from what happened last year. The same thing happened. I mean, you could set your watch by how this is happening and playing out. And we just got to learn from our prior, you know, errors or prior experience and build to make it better for our kids.
So who does it fall on? Is this up to the health department? Is this up to the school district? Is this, I mean, there's so many hands that are moving. How do we connect them all?
Right. I think that everybody has to be committed. And if you talk to the hospitals, they'll all tell you, well, I'm committed. Well, I'm committed. I'm committed. But if everybody's fragmented and we're all running in different directions, we're not taking care of those who need it most. And right now, that's our vulnerable kids. You know, yes, kids are healthier. No, they don't get it as sick, but some of our kids are dying. And 65% of all the kids that have died in the United States from coronavirus disease are children of color, primarily African American and Latino children. We got to do better for our kids. We know what the problem is. It's not enough to say it's tough that we're short-staffed. It's horrible how transmissible this disease is. Let's put our heads together. We've got the knowledge. We know what to do, and all decide that we're going to make this a priority, not just when it's convenient for us, but what's most convenient for our students and for their parents to take care of them best.
That's an important reminder about how important it is when it comes to vaccination in children, especially in our schools. I also want to note, we did reach out to Philadelphia School District, and they said they've had 35 clinics for students to get vaccinated. I believe there was one yesterday, and so yes, the next one is January 5th. But also, before we close, on a lighter note, I want to make sure to say to you, congratulations, you're a CNN hero. But like I said before, you're always a hero in our eyes. But yes. I wanted to officially say that congratulations on being selected and being introduced by Dr. Fauci himself.
Oh, that was awesome. And we are open today until 4 o'clock. We have walk-ins beginning at 9 o'clock. I'm headed down there. Guys, please utilize us before the holidays. We're also open tomorrow from 9 to noon. Again, walk-in hours. And we will be open after Christmas. We're even open New Year's Eve from 9 to noon. So just go to our website, bdcccares.com, and you'll see our schedule.
Okay, thank you for that reminder. And of course, you can get vaccinated, get tested, and also just get regular health care at your center. Right. So you're doing amazing work. Thank you, Dr. Ayla.
Thank you, Alex. Have a great day. Merry Christmas.
Yes, happy holidays. We'll take a break.